Hit it.
The tricky thing about gaps in societies and sidewalks is that we get used to walking over them, and in time we may forget they exist at all. So here at Chronicle, we came up with a little reminder.
Let's see how folks do on the Chronicle Mind the Gap quiz. This $1,000 represents all the wealth of the United States. What percentage of this is pocketed by the lower 50% of earners?
Listen here.
20%.
I'm going to guess 33%, a third.
33%. Well, you got the 3 part right. 3% is the correct answer.
That's rough.
Yes, 50% of the country possesses 97% of the wealth. This is just one of the societal gaps we examine with experts.
Many of the issues related to the wealth gap, the transportation gap, to the food gap are all connected.
And some passionate people working on solutions.
We see our farm as a way to meet that gap by providing fresh produce to everybody.
Tonight, Chronicle explores a number of ways to mind the gap.
This is Chronicle on WCVB Channel 5.
To find a beautiful, thriving farm here in Ipswich is not surprising. But this farm's purpose stands out.
We are a community farm, a nonprofit organization, and we have a food access mission, which means we are trying to get fresh produce that's locally grown to people who otherwise wouldn't be able to afford it. We are the only production scale farm on the North Shore with a food access mission doing this work. My name is Liz Green. I'm the executive director here at Three Sisters.
Increasing access to healthy food fills a gap not usually associated with the North Shore.
There is a lot of wealth here and a lot of means, but there are also a lot of folks who are really struggling. We accept SNAP, which is food stamps, and we also have free shares available.
The passion of Green and her staff absolutely translates into their product.
Sweet peppers, bell peppers, a little bit of hot peppers. You'll see it's going to be a couple hundred plants of each variety that are going in. Over here, eggplant.
And once you get a taste of fresh produce, you just might want to start growing some of your own.
We have a lot of folks who get a weekly share with us, and then they're also doing a garden at home for those things that they love extra of.
The money to run the farm comes from grants and donations, supplemented with full-price customers and farmers markets. But the quality is always the same.
We're really trying to give the first and highest quality to everybody, regardless of if you're a full pay, a sliding scale, or a free member here. And we hear that from folks, that they see that quality and they appreciate it.
Back to our Mind the Gap quiz.
How long does it take for the average person to get an appointment with their primary care doctor?
3 months.
Oh, 6 weeks at least.
I'm gonna go with a month and a half.
That's pretty close. One 2022 study puts the wait time in Boston at 40 days, though this woman believes it's much longer.
My grandma, she's trying to take an appointment with her primary care, and the nearest is September.
So that's 90 plus days, basically,
Yes.
to see your doctor.
Yes.
What do you think about that?
Insane.
I think access in primary care has been increasingly limited since the pandemic. A lot of primary care physicians who were 60 and over retire earlier than they had expected.
Dr. Barbara Spivak believes this is a gap that will only get worse.
The AMA, for example, has estimated that in the next 10 years, nationally we'll be short 125,000 physicians. And having fewer physicians available will delay care.
To fill the gap will require a new generation of primary care doctors, but the field is currently a hard sell.
Many younger physicians come out with $400,000 worth of loans. And to be a primary care doctor, you don't make what specialists make. To know that you could work less, have a better life, make twice as much, and pay off those loans faster, it's not encouraging for physicians to want to do primary care.
When you consider the links between income and medical access, one possible solution could fill two gaps.
We look at countries where medical schools and training programs are free, and then people are expected to work in underserved areas for several years. And we could do more of that.
In addition to serving as president of the Massachusetts Medical Society, Dr. Barbara Spivak is a primary care physician herself. She says she loves what she does, but the burnout is real and largely related to administrative duties that take time and focus away from patient care. We'll have more details on the data used in our informal Mind the Gap quiz on our website.